Welcome to the Mostly PT podcast. I'm Brant Bomer.
And I'm Alex Bretzman.
And today's episode is not sponsored by Scrub Family. A whole lot of scrubbing. This is dad and this is the baby.
No, that's mom.
Scrub Family. No children. You said this was a baby.
Yes, but that's mom.
Oh.
Because it's pink. Flip it around. There's one like a grit side and there's one sponge side.
Oh, it's mom and dad combined?
No, there's
no scrub mommy.
That's scrub mommy.
There's no scrub daddy.
There is one. I don't remember. It's not blue. No, that might be blue.
Dude, you have to collect them all.
I had a scrub daddy and he got dirty, so I had to throw him away.
Your daddy got dirty?
Yes, we got mommy and I think that's the baby. Look, there's a smiley face on the bottom too. Bottom.
Oh, that's a baby.
Yeah.
Just a baby. Okay.
Just a baby.
Episode 26, I think.
Yeah, I think it is 26.
All right, board review. It's coming up. 3 questions. Let's hear it.
Board review?
It's a board exam. I don't know why you always go
board exam review. Don't say board review. Practice board.
Regardless.
Questions from the PT365 app. Not sponsored.
I can't hear you. Can you have the microphone?
Yeah, sure. Would that be kind of cool if we got PT365 sponsors?
That would be cool.
That would be cool.
I feel like just based off what we say with their questions, I don't know if they would sponsor us.
Yeah, maybe not. We would promote the app really well, though.
We would make some good questions for that. Like,
Yeah.
would you ever be
a questionnaire, like a person that
creates a question?
Person at our school still does it.
Yeah. I'm glad you said person.
Yeah, we're not doxing today.
All right, question 1.
From October 6th, 2025. A patient demonstrates diminished problem-solving abilities and difficulty finding words at times. Additionally, they can only speak in a low voice unless trying to yell and appear to have a flattened effect. What medical condition is most consistent with the described presentation? A. Parkinson's disease. B. Depression. C. MS. Or D. Dementia.
Parkinson's.
Parkinson's disease is correct.
I was gonna say that or the Alex syndrome.
I'm not flat. I like
fluffy.
Hey, I'm bulky.
Okay.
That was rude. From October 7th. Ooh, wound question. Intake question. I'm going to butcher these names. A physical therapist in an acute care hospital performs stair training with a patient who is non-weight bearing following a triple orthodesis surgery of the ankle. After the session, the therapist observes that the dressing over the patient's incision is becoming increasingly pink and damp.
How am I supposed to know that? Okay.
Just try.
Pink and damp.
Pink and damp. What term best characterizes the description of the exudate? A. Sanguineous. Sanguineous.
Got it.
This is bad. B. Serosanguineous. This is terrible. C. Serous. Or D. Seropurulent. Purulent.
It's not purulent. It doesn't smell. It's not like green.
Yep. So you have sanguineous.
It's pink and wet.
Pink and damp. Sanguineous, serosanguineous, or serous.
Serosanguineous.
B. Serosanguineous. That would be correct.
Thank you.
Sanguineous is just red. Serous is clear. The serosanguineous makes it pink.
I wonder if Lil Uzi Vert sang about this.
Probably.
Sanguine in Paradise?
Yeah.
It's talking about wound care.
Ooh, this is a tough one.
Okay.
From October 8th. This smells.
It does smell. You can throw it.
I gotta stay committed.
The baby smells.
A physical therapist performs circumferential measurements on a 4-year-old child and notes edema in both lower extremities.
That's a problem.
Based on the clinical presentation, what diagnosis is most likely? A. Lymphadenitis. B.
It's not that, but...
Not lymphadenitis?
No, that'd be one-sided.
B. DVT.
No.
C. Milroy's disease.
That sounds maybe right.
Or D. Wilson's disease.
That also sounds maybe right. Milroy's or Wilson's?
Milroy's or Wilson's.
Wilson's.
Incorrect. It's Milroy's disease. Milroy's disease is primary lymphedema.
That is lymphedema.
Lymphedema that presents in infancy and is bilateral lower extremities.
That's bilaterally.
I know.
Okay.
Usually it's unilateral.
Would you use compression? What kind of compression would you use for that?
Distal to proximal.
Okay. Short stretch or long stretch?
That always throws me for a loop. Short stretch versus long stretch, man. That's something I gotta brush up on for the boards.
Yeah, you have like one question maybe.
Wilson's disease is an autosomal recessive inherited trait that produces a defect in the body's ability to metabolize copper. The condition would not result in edema.
Yeah. Okay.
All right, I gotta plug my phone in too.
Plug your phone in.
What's
Guys,
next on
we're
the
gonna go
docket?
with would you rather.
Would you rather?
Would you rather?
Let's go.
Would you rather?
What are we rathering, Woody?
You gotta get into the.
Would you rather?
You coming back?
I gotta put this away. Why are these open?
All right. I'll. Hey guys.
Start the question.
Please like and subscribe.
Like and subscribe. If you're new to the channel, drop a sub.
Stop commenting about our feet.
Yeah, don't do that. That's weird, guys. This is like your 6th morning. Let's don't do that.
At some point, we're gonna have to put on shoes.
It's this. Yeah.
And I'm not shaving my legs.
Yep, me neither.
Okay.
All right. Would you rather?
Would you rather have the power to erase your own memory or other people's memories?
Ooh.
So, stipulations, you have the power to do it, so it's unlimited, right?
I don't think this is a question. I don't know if there needs to
Maybe
be
you
many
get like a
stipulations.
punch card, you can do it 5 times.
No, I think it's the power you have it for life. Like you got it, you know? It's like you're born with it.
I just don't understand the benefit of erasing your own memory.
Like if you had a traumatic past.
Okay, so that's what, are you going with erasing your own memory?
No, other people's.
Yeah.
That's too easy. I think that'd be cool. Well,
that's why I think it should be a punch card.
Okay.
Like
10 times?
No, 5.
5 in a lifetime?
Yeah.
How big can the memory be? Could it be like a certain point in time, or could it be like a day?
It erases the whole memory.
No.
You punch it, done.
Not the entire memory. I think the question is saying like you're erasing a bad memory that someone has of you. That's what it's getting at.
I think it should be the power to erase all of your memory or erase people's separate memories.
Why would you want to erase all of your memory?
Restart.
No, that'd be terrible.
A restart.
You would lose the ability to speak.
I wish I was a kid again. Their perspective.
So, okay, the way that
I'm going to go with erasing my own memory.
The way that you're asking the question is, would you rather completely start over cognitively yourself or choose someone to? That's nuts.
You still have the cognitive capabilities. You just don't have your memory.
That's not what the question is asking, I don't think.
You know what? We created the question. So really, it's anything we wanted to ask. Can we please come up with something so we have something to go off?
It's like if someone saw you fall off your bike, and so you would have the power to erase the person's memory of that moment.
Yes.
So they no longer know.
I agree with that. That's fine.
Yeah, that's what it is. It's not like you're functionally resetting the person. That's not what the question is. It's
okay,
like
so reword the question so I get something to go off of.
Would you rather be able?
Would you rather question should be? Would you rather have the question like this or like this? That's what we're doing right now. So,
would you rather be able to erase an embarrassing moment in your own memory or an embarrassing moment in someone else's memory of you?
Okay.
That's what it is.
Yeah. Unlimited?
Right. So would you rather unlimited? You got the power.
I'm gonna go myself.
I'm going still someone else's. So like let's say you fall off your bike in public and your friend saw it and they won't stop giving you the business about it, and you can say boom, and they no longer remember, and they can't.
Or I could go, boom, I don't care because I don't remember.
But they're gonna constantly remind you of it, and then you're just gonna be like, I think that didn't happen, and then you're gonna be like, you're gaslighting me, and then you just ruin a friendship.
And then I erase my own memory again, and I go, oh, I forgot that friend.
Your brain would be fried.
No, I could take out everything that's bad. My whole life would be positive. I could erase all negative thoughts.
That would be awful.
I could erase all negative thoughts. And if I'm feeling bad that day, boom, erase them.
If you've never had a negative thought in your life would be terrible.
Fine, I'll erase some positive thoughts through there.
Like, you're never gonna face adversity in your life, like a tough time? I'm saying like,
I don't know why you're trying to...
What name a memory that you would want to erase, or like, can you think of an idea? You don't have to give me like a specific one, but you're so for erasing your own memory. What would you even erase if you had the ability?
When I was in 4th grade, I could talk like Donald Duck, and our principal came into the room and he said something, and I thought it had to do with me talking like Donald Duck, and I started talking like Donald Duck, and I was an idiot, so I looked like an idiot because it wasn't about that. It was just random me speaking like a duck. I would erase that because I still think about that to this day.
That's some deep trauma. Should we unpack that a little more?
No, I just would erase it.
Okay, that's a good answer.
Thank you.
Yeah, like I would erase the principal's memory of that happening.
I mean, it'd be kind of the same outcome.
Right. It's
But I feel like I'd have more control because it's all me. Like, once you start erasing people's memories, that's going to affect the universe.
yeah, but if you start erasing your own memory, you're impacting the universe too because you don't remember something. It could lead you to do something that you wouldn't do.
And then I just erase my memory. And then if the universe is
you
screwed,
just flat restart.
I don't remember. I have more control over that.
That would be.
Anytime I'm having a problem, I erase it. Let's say you're feeling bad
Can't
for
have any
erasing
problem.
someone's memory, you're going to always think about that.
Can't have any problems if you erase your own memory.
Yeah. Let's say I get Alzheimer's when I get older. Erase that memory.
Well, that kind of happens naturally.
Dang.
That was a good question.
Yeah. I don't know if one of us won that, to be honest.
Well, it's okay. Here's the problem that we have on
It's
this
not about
podcast.
winning. It's about discussing.
You and I are so ultra competitive that we refuse to agree on everything. I shouldn't say everything. We refuse to agree on the most common, simple things of questions. And B, it's all about one-upping one another instead of saying, you know what, that's a good point, or Brant, I respect your opinion, but in reality,
I respect your opinion.
I respect your opinion too. But in reality, it's
try
like
to destroy it. Yes.
you're like it's like that's the stupidest thing I've ever heard. Here's why you're wrong.
That's called testosterone.
Yeah, is that what that is?
Aldosterone.
I hate testosterone.
You do?
No,
I feel like you do like it.
I enjoy my healthy normal dose of testosterone, but that's naturally occurring in my body.
That's good.
You know what the norms are?
No.
I think it's 100 to something. 100 to, I want to say
what?
that.
Grams?
There's a specific unit of measurement that I'm not exactly sure.
Okay.
I watched a video on national testosterone though, and you know it's directly correlated with bad intelligence.
Like you have more.
The lower your IQ is, the higher your testosterone is.
Really?
Your natural build.
Why?
I don't know.
Where's this at?
I saw a study of the
source?
graph, and it was a perfect.
You saw one study. Where was the study at?
I don't remember. And then there's one person. It might be fake, but there's one person at the top with like a 150 IQ with like 800 natural testosterone. Like we need to
feel
find
like
that
Albert
guy.
Einstein had some wicked testosterone levels.
You think he's just jacked constantly?
His name's Albert.
That doesn't make it. Your name. Does your name determine your smartness? Your intelligence? I don't think it does.
Well,
I've met a lot of people that I'm like.
Girls have less testosterone, so.
And they're smarter.
And their names are female names, so I'm not trying to get political or anything, but that would be it. All right.
Women are more intelligent than us. Proven fact. Do women actually have higher IQ scores? That's something.
I feel like we shouldn't look that up or answer that.
All right, let's.
We're all human beings.
Everyone's intelligent in their
world.
own way.
Yes. You matter. Rec sports, recreational sports.
What a transition.
What a transition. I've been really working on those.
What are recreational
If you guys
sports?
don't know, we are in recreational sports. Football just got wrapped up. Alex and I faced off in the championship game. Do you want to tell us the outcome? It was a good game.
It was a really good game. It was the 4 seed against the 1 seed in the 10-team bracket.
We were not a 1 seed.
You were the 1, weren't you?
No.
Then you had to be the
We
2.
had 2 losses.
Yeah, everyone had a loss.
We had 2 losses.
Oh, so no, you were the 2 seed because we beat the 1 seed in the semis.
Yeah.
So, 2 seed versus the 4 seed in the flag football championship.
The Red River Valley.
The JV All Stars took a loss to the what's your guys' team name?
Just above average. No, it's something with average.
Something above average.
No.
Well, we were deflating ourselves.
Average at best.
Average at best. So
Yeah.
we're both deflating ourselves with our team name because you're calling yourself average at best, and we're calling ourselves the JV.
And we were at our best, so we definitely were average.
And we ended up being in the championship. So I guess it's self-defamation is really good for athletic recreational teams. Anyways, the average at best team did defeat the JV All-Stars 10-8.
It was 10-8.
10-8. 10 touchdowns, 8 touchdowns. Close game. It was 5-5 at halftime. Very crucial play at the end of halftime that basically cost my team the game. Some freak of nature on the other team caught a Hail Mary to tie it up, and then
No one else really jumped with me.
I don't know why. I should have called a timeout.
Unless they were trying to. No offense. It didn't seem like anyone was trying to.
No, you were 2 feet clear above everybody else. Yeah. Brant caught the touchdown. He also had 5 touchdowns total against us. Couldn't stop him. You did not have 7. There's no way you had
I
7.
had 4 or 5 in the first.
Seriously?
Yeah.
Wow, I thought I was doing you.
Who else scored? Well, I'm not trying to toot my own horn, but
Brant.
I ended up pulling my hamstring in the end. So really, yeah.
Brant.
And not catching.
So who really won? The healthy guy or the guy that won but tore his hamstring? So yeah.
I'd rather win.
Some people would say people that play recreational sports outside of high school and college are,
trying to keep the yearbook
stuck in
open.
the old days. What would you say to that?
You know what? I don't really care what they think. I might still be stuck in the old ways, but guess what? You can still have new days with the old days.
You know how
I'm in rec sports because I need some competitive stuff in my life.
I would agree with that statement.
Otherwise, it doesn't feel very exciting.
I would agree. I think I could frame it more towards that it's just good exercise in general. And while you're in your so-called athletic prime or the stage where you're the most active, most healthiest, I think you should be doing activities that keep you in somewhat relatively good cardiovascular
Enjoy,
shape.
because if you're doing it for exercise, you run the marathon.
Yeah, I'm not necessarily doing it for exercise. I'm saying that's a plus that anyone
It is a
can get
plus.
out of it.
Yeah,
I'm doing it because I enjoy playing competitive sports.
it keeps your power up too, because I feel like that's something you lose pretty quickly when you're out of sports.
We talk about determinants of long healthy life, and muscle mass is a main factor of determining long healthy life function. So get out and play some rec sports. You might be wondering why we're wearing jerseys right now. It's Jersey.
Or wearing socks. Well, you already know the answer to that.
It's Jersey, Brent.
It's Jersey?
It's Jersey.
Actually?
Thursday, Jersey.
Oh, you just come up with that?
No, I stole it, but
You should have said you came up with that. I never heard that.
Yeah, it's Jersey.
Jersey, Thursday.
And we got told by our volleyball team captain that we need to wear jerseys to recreational volleyball tonight.
And we're good boys, so we did it.
And so we threw the jerseys on, and we had to do it for the pod because Brant wanted to. And I had to comply.
I'm trying to manifest like us getting set
Do you know what our record is?
Yeah, it's not good.
It's sub 500.
It is?
We're 13-17.
Yeah, well, we lost to a team with 4 people, so that's no matter even if we win
They were wicked.
a lot, like that honestly, I lost some sleep.
We're not doing too
I lost
hot.
some sleep after that.
Yeah, that was a tough loss.
We should talk about volleyball a little bit. Volleyball is frustrating because you can be very athletic and you still get crapped on.
That's the best thing about baseball.
Really?
I had a coach give me a quote one time: "Is you can do everything right and still lose."
But
And that's kind of the stupid.
everything right.
Right. I'm just saying that I don't know why they came to mind, but you can make no errors defensively. You can get a hit every single time, and you can still lose the game.
Well, that is not the case we're in.
Anyways,
Because-
volleyball, sport that I've taken up over the past 2 years, indoor and sand volleyball. I feel like I've gotten.
You have made some big strides.
I've become a very slightly above average volleyball.
Just above average.
Yeah, and you know what? That's where I like to live my life. Is
I
slightly
feel like your
above
verticals increased just being in volleyball.
Dude, I could jump. I could
Yeah.
dunk a softball.
You can?
Yeah.
Nice.
5'10" white guy dunking softballs.
Shouldn't matter what your skin color is.
Oh, I'm sorry, but that was being stereotypical of me. I'm sorry, but
I'm Italian and I can jump.
I could have a little Italian in me.
Really?
Western European.
I don't even know where Italy's at, but yeah.
That's the boot.
I don't know what that means.
Volleyball's cool. It's a sport that I've grown. I think I have a newfound appreciation for volleyball players because it's very difficult.
It takes skill and athleticism.
It takes skill and athleticism, and I will say this about it: I don't think there's as much like strategic play that you could possibly do. Like I know you can run different formations and stuff with like where the setter is on the court. Maybe I just don't understand it enough.
I feel like we don't understand it.
Probably. It probably goes a lot deeper than the baseline knowledge that I know. But I think there is a strategic component with like substitutions and stuff and who you play where.
Yeah.
And Like you're not
It's a
going to
very. I feel
It's a
like
reactive
really good
sport.
team sport too, though.
It's a
Like,
great team.
You can't just have one good player.
No, it's a
Because-
team. You have to have at least 6 average players to be solid. Like it's hard to hide somebody on a volleyball court unless they're just coming in to serve.
Unless you say, hey, sit to the sidelines, let's play with 5.
Right. And we've done that before.
Yeah.
Yeah. And you know what? We had to do what had to be done.
It's 8-12.
Volleyball, rec sports. Get out and you know what? Go join your local softball league. Go play some beer league softball. Go play.
Go have a dip in the pool and play some water polo.
Go join. What other rec sports leagues are out there? Pickleball.
Pickleball.
That's a great one.
All you people 50 plus.
Fastest
And you know
growing
what?
sport in America.
Yeah.
They say.
Yeah.
They say. They looked it up. It's not true.
What is it? Cricket?
It's the NFL.
Oh.
It's still football.
Okay.
Um,
Plyometrics.
PT topic of the day: plyometrics.
What are plyometrics? Should I answer it?
I'll give-
definition.
I'll
your
give
definition.
my best non-dictionary answer what a plyometric is, and then you can give your
Brand dictionary.
plyometric that I'm trying not to explain how you said it earlier.
I should just go with mine first.
Sure.
All right. What is a plyometric? I feel like a true plyometric is an high intense movement that requires a high amount of energy, and we can delve into the specific factors that makes a plyometric, but you should be well recovered when you're doing these. It's low volume, high intensity exercises.
What factors make it a plyometric? You said about the factors.
Rest time, I feel like it's a big one, and intensity.
I could just say that is powerlifting a plyometric then?
No, because the speed of motion is not the same as a plyometric.
So I think that's
high velocity, high intensity, low volume.
There you go. That's
okay.
What
That's what you're gonna say.
That's what I was trying to get you to. I understand what you're saying, but for them,
high intensity considered the high velocity.
I would define a plyometric as an explosive movement commonly associated with jumping and/or pressing very, very fast. And you want to be giving maximum full effort with every single repetition that you can.
Okay. Yep.
And I like the factor of go as hard as you can for short periods of time, but having adequate rest amount to let your body recover to be able to go full intensity next time.
Yep.
Yes.
And that's how the next thing about it, how to program them effectively.
Who uses plyometrics?
Example.
Who could benefit from
Oh well,
plyometrics?
that's the next thing.
What do you mean program them effectively?
How do you get someone to be faster? How do I get this person that wants to get faster? How do I get them to be faster?
I would do some explosive plyometrics.
Can we have some specifics?
A lot of single.
And-
I would do like a lot of squat jumps.
I know, but we should go like dosage, which I feel like is the most important part of plyometrics.
Okay.
Dosage.
I'm not very familiar with dosage, but I'll take my best shot of the knowledge that I have. If I'm going to do a plyometric with the patient, I would say no more than
Sprinting, for example.
I would do time periods then. So we're going to do wind sprints. You're going all out for 10 to 15 seconds. As fast as you can.
Why 10 to 15?
I think anywhere else you're starting to get into other energy symptoms, and I think you're commonly doing the
What energy system?
creatine phosphate.
ATP,
Yep,
PC.
ATP. Yeah.
Good. That's good.
Yep.
Yeah. What
Usually-
exercise? If you had to give them one exercise to get faster at running, what would you give them?
Run.
Yeah.
Sport specific. You want to get better at one specific movement? Do that one specific movement, and do it a lot, and do it at high intensity, especially sport related stuff. You want to get better at shooting a basketball? Shoot a basketball. Well, that we could get into.
Okay. Well, I'm still asking some questions, trying to pick
Okay.
your brain.
Yeah, pick
How
my
many days a week are you gonna have them do this?
Depending on how many muscle groups that we're using, and depending on the amount of fatigue that the person is going.
Just
under.
sprints.
Just sprints.
Just talking about sprints.
I'd go every other day.
Okay.
Would you go less?
I'd go once a week, maybe.
Really? I'd go a little bit more than that. Well, I would say, here's what my lifting brain would say. I would do the exercises as many times as you could, then you were able to recover within that time period. So if you can do 10 wind sprints and take 2 days rest, and you feel ready to go again and do them again, that's when I would
I
say.
feel like that could work.
I would say whenever you feel rested enough to do the next workout, that is when you should do the workout.
And how do you know if they're well rested?
You want to go like in between sets or in between workouts?
Well rested between Monday and Thursday.
Okay, so muscle fatigue, DOMS. Do you have soreness in your muscles? I think that's basically the number one predictor. Are you still well hydrated enough?
I don't know if you'd get DOMs with plyos that much.
I think you would. For a squat jump, yeah.
Maybe.
Running.
Yeah, I guess.
You get sore
it
from
depends
running. If you are running. Like,
Yeah.
if this is someone that isn't a high velocity runner, they want to get faster running, they don't do a lot of running in general.
Then I could just have them run. It
Right.
wouldn't be have to be that specific, but like,
Wow.
like a
sprinter
athlete.
Okay, well,
Or like an athlete that wants to be an elite athlete. I guess I should have specified that.
then I'd say, yeah, they're going to be able to recover very well because their muscles are used to that kind of fatigue. So I think your frequency timing for the exercise is probably going to be quicker.
I would say you'd have to do some kind of objective measure of, okay, your sprint was 10 seconds today. It's 11 seconds on Thursday. That's probably not enough time to recover.
Yep.
Then.
As long as you're able to, to be able to progress. If you are falling below what you were doing last time, you aren't adequately rested, and you need to take longer periods of time to rest.
I think one factor too that's really hard to manage is motivation, because it's very hard to go at that high of an intensity. Like to do a squat jump as high as you can 5 times sounds easy. That's not like
No.
as high as you can.
Like, if it's truly like everything that you have, it takes a determined person to do it for sure. That's why it's you use it in athletic populations, because they usually have that mental toughness built up and they're determined enough to do that. I will mention this. With plyometrics, like any exercise, I think you need to integrate other exercises with it. You can't just be doing just plyometrics. You need to supplement them with other exercise. Like open chain, closed chain exercises of the same joint, doing isotonic movement, concentric, eccentric movements of, I just did the quad, and isometric stuff. Doing other movements that are focusing on the same muscle groups that you're working, or even better, doing other muscle groups to let the muscle groups that you're working on rest. So if you're going to go and do wind sprints on Monday for your plyometric exercise, workout, whatever, and your rest days on Tuesday, I think it's beneficial for you to go do an upper body workout at the gym while your legs are resting. Yes, it's going to increase like total systemic fatigue over time, but instead of just doing nothing, being able to stay active is going to keep your metabolism up, going to get the blood flowing in your body a little bit. Yeah. So strong advocate for not just training one muscle group and one muscle group only.
Do you want to ask me any questions? I feel like I'm just grilling you.
So we talk about plyometrics in like return to sport protocols. When do you think patients, let's go ACL rehab. When do you think patients should be doing plyometrics, or should they or should not they be doing plyometrics?
Okay, ACLs for example, they have to have full, like the ratio between quads and hamstrings has to be appropriate. They have to be, obviously should be relatively pain-free. I would consider that. Time for healing. So probably getting into some kind of running 12, 16 weeks.
Yeah.
Around that time.
So 12 probably on the shorter end. But
yeah, 12 to 16. 16, hopefully
right.
You're doing some kind of return to sport, like straight ahead running, sprinting.
Yeah, no cutting or anything like that.
Yeah.
I agree, yeah.
Any other miscellaneous questions on plyos?
What's the hamstring to quad ratio? Do you remember?
It's got to be close to 1-to-1. I think
it's 80% is the minimum. I
mean,
swear
80%?
I saw it, like 80% hamstring to
It's
quad.
a ratio.
Yeah, so 4 to 5.
Oh, okay. Yeah.
I think I saw it on a practice question actually.
Hamstring to quad?
Hamstring to quad.
Oh, so you want hamstrings?
No, you want quad's going to naturally be stronger than your hamstrings because they just do more movements in life. But it needs to be, your hamstring needs to be at least 80% strong.
I would say
as
just
your quad
compared to the contralateral.
I think it
side.
might be. Yeah, that's what it is. Yeah, I think that might be what it is. Maybe it's 90%. I'm not sure. Don't quote me. Go and visit your local physical therapist if you have any questions about your ACL.
Yeah.
We are not medical advice people. We just talk about it.
Yeah, you can look in our bio.
Yeah.
I would say one thing too, adding exercise that let's say we'll stick with getting faster. What is the ability to get faster? Move your legs faster. So like band assisted sprinting, something where it's going to force you to move your legs faster, but you're actually able to do it. You can't just say, "Oh, move your legs faster."
So yeah, that's where you get like into like you could do it
like band
assisted
stuff. Yeah,
you could do it underwater for increased resistance.
Yeah,
like on a treadmill with like a thing.
Yeah.
Or you could do like parachute.
Yeah.
With resistance. Anything If you want to increase muscular strength in anything, add resistance to it. Load it. That could be another topic for another day. I have a quote that we should talk about in another episode today. Maybe we talk about that next time.
Okay.
I like that. Yeah, this has been a good episode.
It has. We got to get to volleyball.
We do. What time is it?
This has been episode 26. Mostly PT Pod out.
We'll see you in the next one.